I am Dr. Pavan Lohiya, consultant ophthalmologist at Sunshine Eye Care Hospital. Today we will discuss about diabetic retinopathy and its importance. What is diabetic retinopathy? Normally diabetes is nothing but increase in blood sugar, but over the period of time when diabetes is not under control, it start affecting our organs, and one of the major organ is eye. So when sugar is high, it start damaging outer layer of the blood vessels, and this outer layer of blood vessel when get damaged, they become leaky, and the blood, cholesterol, lipid layer start oozing from these blood vessels. So in our inside the eye we have a lot of small blood vessels, and when they get damaged in early stage, the small ooze start appearing, and if it is not under control, or if it is we don't treat it early stage, then it can progress to advanced stage, and where bleeding can occur, or even retina get damaged or retina get tear, and that time it become irreversible and blindness can occur. So it is very important to detect early diabetic retinopathy, so we can treat it at early stage and we can prevent the blindness. So what are different types of diabetic retinopathy? There are two major types. One is non-proliferative and one is proliferative diabetic retinopathy. In non-proliferative means it is early stage where damage is limited to small part of the retina, so we can treat it just by drops, sometimes laser, and when it is progresses to proliferative or early proliferative diabetic retinopathy, we may need to do some laser injection, and if it go even advanced stage, even multiple surgeries may be required, and even after doing multiple surgery, vision may not gain, or we will have limited visual recovery. So most important thing in diabetic retinopathy is doing regular yearly eye checkup. So those who have diabetic retinopathy, they should go every yearly dilated eye examination by ophthalmologist, not just by number checkup, but proper fundus examination, so that we can detect the diabetic changes in our eyes, and if there is any changes, your ophthalmologist can guide you for early treatment, and so we can prevent the blindness. So diabetic retinopathy is the treatable blindness, and which is now increasing as diabetic population in major urban and rural area is increasing day by day because of our sedentary lifestyle. So it is very important to understand, to prevent, to detect it at early stage. So normally if you are at the early stage of diabetic retinopathy, mostly controlling sugar, controlling lipids, controlling your hemoglobin, BP will help you in retarding or preventing further progression of diabetic retinopathy. If it even worsen, then you may need to consult your endocrinologist for controlling your sugar, and your ophthalmologist may start you some drops, and sometime he may advise you to go for early laser to prevent further progression. So these are normal treatment which is advised at early stages. If it is very advanced stage, retina specialist may be required, and he may guide you about laser injection and different type of surgery to remove the blood or to settle the retina. Thank you. So for diabetes, please undergo every yearly minimum once in a year eye checkup, dilated eye checkup, and if your ophthalmologist advise you any 6 monthly or 3 monthly checkup, please do it, so we can detect, we can prevent the preventable blindness, that is diabetic retinopathy. Thank you. I am Dr. Pavan Lohiya. You can contact me at Lybrate.